Sleep apnea affects anywhere from 9 to 38% of the population, and I'm one of those people who have it. I got diagnosed with this 2 years ago, and if you don't do anything about it, it can kill you. And this is something I think about a lot because my mother, when I was in high school, passed away from a stroke. And one of the things that sleep apnea can cause is an increased risk of either having a stroke or a stroke-related death. I didn't want to suffer the same fate. And so I've spent the last several years figuring out how I can improve my sleep, but not just mine, but also some of the patients and clients that I work with. And so what I'm going to show you today is a tier list of conservative measures that you can try if you suffer from this condition or if you just have trouble sleeping. Now, this isn't a substitute for medical advice. If you have sleep apnea, please, I beg you, get checked out by a medical provider. That's what I've done, and I've done some of these under the guise of medical providers. But my hope is that this list can give you some options that you can choose or run by your physician that may help you get the sleep that you deserve. The first treatment we'll talk about is positive airway pressure. This could be a CPAP, a BiPAP, or anything like that. So understand how a CPAP works. We first have to understand how breathing works. So when we breathe air in and out through our nose or our mouth, we use what's called negative pressure. Here's how that works. Suppose I take this syringe. Don't ask why I have it, but I stick it in water and I pull the plunger out. You'll notice that now the syringe is filled with water. That is negative pressure. So basically what I did was I used pressure to pull something into the tube. We do the same thing when we breathe. When we breathe in through our nose or our mouth, we use this pressure to pull air in. A CPAP uses positive airway pressure, which basically goes the exact opposite route. You hook something up through your nose or through your mouth, and you apply positive pressure to push air or force air into the body. This helps keep us oxygenated while we sleep, so you don't croak. Now, according to the research, if you have moderate or severe obstructive sleep apnea, you kind of sort of need to do this. It is the de facto treatment. Now, it doesn't reduce your risk of cardiovascular disease, but it does improve daytime sleepiness, quality of life, among other things. Now, personally, I have mild to moderate sleep apnea. In my case, this is recommended after you've tried everything else, but I figured, what the hell? Let's give it a shot. And give it a shot I did. And when I tried it and I was able to sleep with it through the night, I actually got a ton of the benefits. I felt more rested, refreshed, I had more energy throughout the day, and sleep just felt good. But those nights were few and far between because one of the biggest issues with CPAP is compliance, or how often you wear it. It's uncomfortable. Like, you got this thing on your face that you gotta try to tolerate wearing over the course of the night. And for me, if my nose was congested at all, I wasn't wearing it. They don't really tell you how to adequately titrate this thing, and they don't have like systems in place to help you with that. But I'd wake up with my nose dry, or sometimes in the middle of the night I'd have it thrown off, and it's just you get the air building up in your mouth, and see, I still have trauma when it comes to talking about this. But these reasons and more are why compliance with this therapy is so low. In fact, research shows after 1 year of treatment, only 30 to 60% of subjects actually continue using the CPAP. And here's the crazy thing. What they consider compliance for the CPAP is 4 hours of sleep. Most people should sleep somewhere between 7 and 9 hours of sleep. So they've kind of artificially deflated the amount of sleep that you need to consider it being a good outcome. But all that being said, if you have moderate to severe apnea, you need that little extra boost. And so for that reason, I have to put the CPAP on the B tier. If you can tolerate it, it feels amazing. But if you can't, you might want to talk with your doctor or try some of these other options. And one of the other standard treatments recommended for sleep apnea is an oral appliance, or a mandibular advancement device. Here's how this works. Basically, you put it on the upper and lower teeth, and it brings the jaw forward and it keeps it forward. In some individuals, when they fall asleep, especially if they have retrognathia or a retruded or fallen back mandible, like your boy, the jaw will fall back and the tongue will as well. That reduces space in the oral cavity. You wake up, problems ensue. Mandibular advancement device basically does the exact opposite. Now, the research shows it's not as good as a CPAP at improving or reducing the number of apneic or events throughout the night or the periods that you go without breathing, but it works pretty well and compliance is a bit better. The people who this works best for are those with a lower body mass index or BMI, people who have a retruded or recessed jaw, more mild to moderate cases, and they have good mandibular protrusion ranging range of motion. And one major advantage that these devices have over CPAP is they actually do have cardioprotective effects. There's some evidence that shows that these devices can actually reduce your blood pressure while you're asleep, which is a big win. But it's not all puppies and rainbows, because if you use this for the long term, there is a risk of permanent changes to your bite. I've had some patients and clients present to me and they have that kind of like dog face or almost an underbite, and that's a big risk with this appliance. The other thing too is it's not always super comfortable, and you can end up drooling a lot because if it doesn't have good closure between the 2 points, you got all this slobber that's exiting your mouth. And when I tried a mandibular advancement device personally, that was the issue that I had. I'd wake up because I was mouth breathing a lot more because I couldn't really close them together, even with tape, and I was just drooling everywhere while I was sleeping. And the other thing is it wasn't super comfortable on my teeth. Now, I got a special one made that goes on top of these Invisalign retainers that I have, but after trying it for a couple weeks, I'm just like, screw this. It's not what I thought it would be. So for me, this goes B tier along with CPAP just because it is one of the standard treatments that's recommended for sleep apnea. And if you can tolerate it, it works wonders. But do recognize that there are some real drawbacks to using this type of therapy. Now, unlike CPAP and mandibular advancement devices, which can have questionable compliance, this next one that we're going to talk about has incredible compliance. And the best part is it's pretty much free, and that's positional therapy. Yes, folks, sleeping on your side. The most common position that people who have sleep apnea tend to stop breathing is on their back. And that's because when you're on your back, the front to back airway dimensions get smaller, gravity has a tendency of pushing the jaw back, and the tongue can fall into the back of the throat. So basically your airway closes, problems ensue, you can't breathe, you wake up. In fact, when I was having major apneic events a year ago, that's what I would feel. I'd feel my tongue go in the back of my throat. Now, if you side sleep, you actually have the exact opposite effect. The side lying position, according to this study, increases the front to back dimensions of the rib cage and the airway because of gravity. Now, when you look at comparing positional therapy to a CPAP is better at reducing the number of apneic events, but you still get benefits from side sleeping. It can reduce the AHI, the apnea-hypopnea index. That's the big marker that people use to track sleep apnea. Positional sleeping can improve this number by at least 5 points. And the thing that works well for this therapy is compliance is a lot higher when you compare it to a CPAP. And that's why side sleeping has been one of the most effective treatments for me personally in terms of improving my sleep quality. I try as much as I can to sleep on either side. And if by some chance you have a sleep study that measures the number of apneic events in different positions, you might actually have a side that performs better in terms of reducing the frequency of those events. For me, it really depended on the study. I don't have one side that's necessarily better than the other. And here's the cool thing. If you're someone who struggles staying on your side, they actually make devices that you can wear that basically prevent you from going on your back. Whether this is a t-shirt that has tennis balls in it, or even a device that you can wear that vibrates when you're on your back. And that's why I put side sleeping on the A tier. The best treatments are the ones that you can do consistently, and side sleeping is really easy to do, and it is effective. I would have put this on the S tier if it reduced the number of apneic events on par with a CPAP or a mandibular advancement device, but it's just not there yet. But for not really having to do anything, it's totally worth it. Now, you can do all of these standard treatments to improve your sleep apnea or just sleep in general, but if you're not taking care of your sleep hygiene, you might as well throw all that out the window, because the number of apneic events is only one piece of the puzzle when it comes to sleep quality and more. Sleep hygiene is something that can affect that piece. Here's what I mean by that. When it comes to sleep apnea specifically, there are 3 key hygiene-related factors that just crush your sleep. One is alcohol before bed. Another is poor temperature regulation. So is the room too hot or too cold? And the third thing is activities that require intense concentration or emotional arousal before sleep. Basically, if you're doing these things and you have sleep apnea, it's going to make it worse. And this is especially true if you are overweight or you're not sleeping enough hours. Now, there's other things too that can affect your sleep quality, not specifically to sleep apnea. If you go to bed late or you experience social jet lag because work or play keeps you up way later than normal, all of those factors can also negatively affect affect your sleep quality. However, interesting thing, the research does show that sleeping in on weekends actually can offset some of this. But ideally, you're practicing all of the hygiene tips that I'm going to recommend to you at the end of this. But I could tell you from my experience, one of the most impactful ways that my sleep improves is when my hygiene is on point. Or put another way, when I am not good about my sleep hygiene, that's when my symptoms are the worst. That's when I'll experience depression, that's when I'll have massive afternoon lulls, and all the negative stuff that I experience with some of the apnea that I deal with. When I have it on point, I'm generally feeling pretty good. Here's some of the things that you can do to improve your sleep environment. 1, get a comfortable bed. You spend a third of your life on your mattress, so it makes sense to get one that works well for you. Generally, for my patients and clients and myself specifically, the firmer mattress you can tolerate, the better. Next, the room needs to be as dark as humanly possible. If there's any light going on, it can wake you up, even if it's touching your skin. Blackout curtains work great in this regard. If the place that you live allows you to do it, I actually like blackout film even better, which is basically this film that you can put over your windows that completely blocks all light. Next is temperature. You want the room to be cold. Somewhere between 62 to 68 degrees Fahrenheit is what I've seen in the research. I personally go with 67, but as we talked about before, if it's too hot or it's too cold and it wakes you up, your sleep is screwed. And you also want the room quiet, or use white noise to drown out any other sounds that may wake you up. And limiting food, drink before bed, those are all factors that you can modify on the regular to improve your sleep quality. Now, one thing that's in there, and this is the thing that I struggle with the most, is making sure you go to bed at a reasonable time. Most of the research that I've seen with the majority of people is if you go to bed after midnight or 1 a.m., your sleep's kind of going to be crappy. And so if you can go to bed at a reasonable time, and ideally around the consistent time each day, those are some of the things that you can do to improve your sleep hygiene, which improves your sleep quality and definitely can have a positive impact on your sleep apnea. And so that's why I have sleep hygiene on an S tier, because having a lot of these fundamental pieces in place can offset a lot of the negative complications that can occur from sleep apnea. Now, having your hygiene on point can set the stage for a wonderful night's sleep, but it doesn't guarantee that your tongue won't fall into the back of your throat in the middle of the night, one of the biggest issues when it comes to sleep apnea. But there is one thing that will, and that's myofunctional therapy. Myofunctional therapy is basically like physical therapy exercises for the tongue, the TMJs, and musculature of the throat. And there's actually research out there showing that this discipline can reduce the number of apneic events by almost 50%, and it can lead to massive improvements in snoring. And in fact, my wife, who has mild sleep apnea, she did a bout of myofunctional therapy and was cured, like has no apneic events now at all, which is incredible. Basically, what myofunctional therapy entails is it's a bunch of exercises that work on improving tongue range of motion, coordination, and strength. It works on soft palate tension, because that's something that can fall down the back of your throat, and keeping the oropharyngeal airway, or the back of the throat, more open as you sleep. Because ideally when you sleep, you should be nasal breathing throughout, and keeping your tongue on the roof of your mouth is a part of that. Doing these various exercises has been a must for me, because if I don't do them, or I lose some of the coordination capabilities because I've been slacking, I will wake up with my tongue falling in the back of my throat. Like, I feel the sensation. It's really weird. Sometimes I'll even feel that just lying on my back if I haven't been doing at least a little bit of these activities to keep that tongue posturing effective. And I've had a lot of experience coaching these motions with several patients and clients, and they can attest to having great improvements as well. I even had a client once who her snoring was so severe that she couldn't sleep in the same bed as her husband because she'd wake him up. But after doing a round of these exercises, her snoring significantly reduced, and she was able to sleep together with her husband again, which is great for their relationship. Now, in my case specifically, my tongue was restricted enough that I needed to get a tongue tie release, and that definitely skyrocketed my results in terms of what I was able to do from a tongue positioning coordination standpoint. And I would wake up feeling my tongue on the roof of my mouth that much more easily. But of course, I had to do myofunctional therapy along with that. Now, there are some instances where that's not recommended. If you don't have enough room on the roof of your mouth to fit your tongue in between the teeth, well, then you can actually make the symptoms worse. I, for the overwhelming majority of people, recommend exhausting conservative measures with this. And I've had patients and clients who have had tongue ties and have still done really well just working on some of the basic exercises taught in this discipline. And for that reason, I put myofunctional therapy on the S tier, because not only does it help with sleep, snoring, and more, but there's a ton of other things that I've seen it work well with, and that includes neck pain, jaw pain, face tension, and so much more. It's one of those things that regardless of what you try, you definitely should be doing it. But even if you have really good tongue mobility, coordination, and more, sometimes while you're sleeping, you may need a little bit of assistance just to make sure you're nasal breathing. And that's where lip taping plus nasal strips come into play. Let's first talk about lip taping. That's where you take some form of tape or bonding gel, you put it over your mouth so that way your lips stay closed, and ideally you nasal breathe throughout the process. When people first started doing this, I think a lot of people thought like, oh, this is just some sort of fad on social media. There's even some publications that came out and said there's no evidence for this and it's dangerous. But those aren't actually correct. There are a couple studies that have come out over the last few years showed that lip taping can reduce the number of apneic events by about 5 points, even if you just use a classic 3M or micropore tape down the front of the lips. Now, I will admit these are not the best designed studies. They had a small subject number, which limits statistical power, but it is at least something. And I'll say for me personally, and some of the patients and clients I've recommended this to, it has actually been quite helpful at improving sleep quality. And there's even research showing that it reduces the amount of drooling, dry mouth, and more. So it is one of those things that I recommend. But it presupposes that you have the ability to nasal breathe. In fact, one of the lip taping studies had some people who couldn't breathe through their nose use medication or nasal spray to alleviate that. So then you gotta wonder, well, how much of a role does that play? The point being is just because you tape your lips shut doesn't mean you're gonna automatically breathe through your nose easily. That's why you need to make sure the nasal passages are clear. If you're someone who tends to get congested during the day or definitely while you sleep, then you probably wanna use some sort of nasal strip. The Breathe Right strips work pretty well for a majority of people, especially if you have a positive coddle maneuver. So basically all that is you take your two fingers, you pull the sides of your nose apart, and you breathe. If it's more comfortable, you should probably use a nasal strip. That's the cheap variation. Now, if you want an even better variation, I like the intake breathing system. Basically what it does is it uses the nasal strip technology, but it also has magnets that go on the sides of the nose and it pulls the nasal passages open. It works similar to a lot of nasal dilators. In the past, I used a mute, for example, by keeping the nasal passages open so the cartilage doesn't collapse as you breathe in. Those are the two that I recommend. Now, in terms of lip taping, the big key is you want to make sure you're using something that prevents mouth puffing. Basically, what that is, and you see this sometimes in moderate to severe cases of sleep apnea, taping works best with mild, is even with tape over your lips, people will puff or blow air out through the mouth. And we want to try to minimize that as best as possible because you want to nasal breathe as much as you can while you sleep. I've tried several different on the market. Now the 3M and micropore tape, that's easy, convenient, and cheap. Some of the more expensive ones that I like are Myo tape, which is actually kind of like kinesio tape that goes around the lips, and it basically puckers them together so that way you keep a good lip posture while you sleep. Now it doesn't work that well if you got a beard, which is why I don't use that anymore. The two that I alternate between right now are lull tape because that one seems to stick the best even when I have a beard, but what works even better is this bonding gel called Sleep Q Plus. Now the negative with that is sometimes it can get the lips ripped apart, and if you're like me, sometimes you leave the cap open and then it dries out. But all of those have worked really well for me, and those are some of the ones that I recommend for my patients and clients. And for all these reasons, I put lip taping and nasal strips in B tier. I would put them them higher, but the problem with these is if you're someone who has moderate to severe sleep apnea, or you tend to do mouth puffing while you're using this, it's not going to be a cure-all, but it definitely can enhance your quality of sleep, and it's something that I recommend most people do if they can tolerate it. But even with taping, myofunctional therapy, and combined, it doesn't guarantee your tongue's going to stay on the roof of your mouth. And that's a key piece to improving sleep quality, especially when it comes to sleep apnea. And that's why I did try some other experimental things to see if I could help with this part of the sleep process. And one of those things that I had come across was a device that's called the iNap. Whereas I talked about before with the CPAP that uses positive airway pressure, an iNap actually uses the opposite, negative airway pressure. It does this by creating a vacuum seal in the mouth, bringing the tongue forward, the soft palate forward, and keeping the airway open. Now, the research on this technology is in its infancy. All I've come across are pilot studies and a study that was funded by the company that makes the device. Both of them have shown improvements in the apnea-hypopnea index. Again, that's the measure that shows how many sleep apnea events you've had. But in one study, the amount was 26% change. The other was massive, but that was the one that was funded by the company. So again, this is a bit more of an experimental treatment. I tried this for about 4 to 5 months. And what I do love about this company is that they do a lot of communication to make sure you're doing well with the product. Like I hopped on an onboarding call to make sure things were working. If I felt like I wasn't getting the improvements that I was getting, I would talk with them and they would raise the pressure. So if like CPAPs did what this company did, man, I think the compliance would be that much higher. And when I first started using this device, I got some massive changes in sleep quality. Like I don't dream, and I was dreaming fairly regularly for the first couple months. But then, unfortunately, after about 4 to 5 months' time, I noticed a drop off in my sleep quality and I just wasn't getting benefits. And I tried going on and off, sleeping with and without the device, and I didn't seem to get much change. I even took a sleep study with the iNap on, and there was no significant difference in the number of apneic events or others. In fact, I would say that the study was pretty much the same. So for those reasons, I stopped using the device. Now, to me, the technology makes a ton of sense from what we want in the oral airway, but I just think there needs to be a bit more research to see who would benefit from this versus not. And so as much as I want to put this one higher, I have to put it in the C tier for right now. And the reason is because although I did get some benefits, it was something I had tried after I've exhausted some of the other measures as an experimental thing. However, I do have high hopes for this company. I think as more research comes out and they figure out who does best with this and they keep up their excellent customer service, I could see this going higher on the tier list. But for me personally right now, that's where I have to put it. I would definitely do some of the other stuff first, and if that doesn't work, then go to the iNap. So I've tried a lot of these conservative measures. Some have led to some really good benefits in my sleep, but I still have apnea. There's still times where I have those major afternoon lulls, or I just don't sleep well at night. The next step when you've exhausted conservative measures is to go to more aggressive treatments. But the problem is you have to be really careful when you're waiting in this domain of sleep apnea treatment. I'm going to talk about that in a later video because I'm undergoing some treatment right now, and I really want to have the process finished before I do so. So hit subscribe if you haven't, and if you really want some more exercises that could possibly help you with your sleep, I would check out this video right here because it goes to some of my favorite progressions that I've used with patients and clients to improve their sleep.